I'm Dr. Linda Gromko. This is Transgender Medicine Made Simple. Today we're going to look at what age do people identify as transgender and when do they seek medical treatment. So we're going to divide this up into little tiny kids, toddlers and preschool kids, elementary school kids, middle school kids, and high school and college age youth. And then we'll look very briefly at adults, young adults, middle-aged adults, and seniors. So starting with the little ones, we hear stories from parents that tell us the kid was always identified as a male or always identified as a female. And sometimes we do hear from parents that a child's first utterance was, "I a boy" or "I a girl," something like that, but very definitive at an early age. These little kids can beg for stereotypical clothing that fits their gender. So begging for boys' clothes if they identify as boys, identifying for female clothing. We see kids who want that stereotypical boys' haircut or girls' haircut, and they're very happy when those things actually occur. We find that kids will typically seek out boys' toys if they're identified as male, and female, stereotypically female toys if they're identifying as female. And these kids will get angry if you challenge these notions about their gender identity and their preferences of toys and different aspects of their lives. There's a very well-renowned expert in the area of children who are transgender, and this is Dr. Johanna Olson-Kennedy. She wrote that these kids can be insistent, consistent, and persistent. I think Dr. Jo Olson-Kennedy says it best. She says that these young kids who are transgender are insistent, consistent, and persistent. And I think that says it very well. Halloween can be a time when kids have free reign of their expression, and so gender expansive kids may be seen to be identifying as no gender. For example, maybe, as you can see here, skeletons or animals in these pictures, or you may find that this is the little trans boy that wants to be a fairy princess on that day, or this is the little trans girl who wants to dress up, for example, as a fireman or something like that. But in any event, it's an interesting thing to watch. Elementary school kids, like little tiny kids, don't require any medical intervention. They get a social transition only. Now, these kids may pursue stereotypically boys or girls activities or interests, or we'll often see them pursuing gender-neutral activities, things like animals, computers, music, that type of thing. In kids who are gamers, we will often see that a child will choose their avatar to be of the gender that they identify with. So we watch for that sometimes. Social transition simply means that when a trans kid is able to use their identified gender, their name and pronouns, that's what's happening for them. They're not taking medications at that point.